Hey gentlemen, welcome back to Dental Miracle. What if I told you that regrowing a missing tooth might take less time than you think? While the world waits for revolutionary tooth regeneration therapies to hit the market, one of the biggest questions on everyone's mind is, how long will it actually take to grow a brand new tooth? Today, we are diving deep into the complete timeline of tooth regeneration, from the moment the treatment begins to the day you can bite into an apple with your brand new tooth. Whether you have been following the Japanese trials, the Korean research, or you are just discovering this technology for the first time, this video will give you realistic expectations based on the latest scientific data. So, let's get started. Before we talk about artificial tooth regeneration, let's establish a baseline. How long does nature take to grow a tooth? Think back to childhood, when your adult teeth were developing beneath your gums. The entire process from the initial tooth bud formation to full eruption took approximately 3 to 5 years per tooth. That is right, years. Your body was building these complex structures layer by layer, creating enamel, dentin, pulp, and roots. Even when you were a baby, your first tooth took about 6 to 10 months just to break through the gum line after it started forming. Now, here is the fascinating part. The scientists working on tooth regeneration therapies are not trying to replicate this slow, natural process. They are trying to accelerate it dramatically using biological signals and growth factors. The current research, particularly from Japan's clinical trials with TRGO35, suggests we might see a fully functional tooth in a fraction of that natural timeline. But how much faster? Let's break it down phase by phase. Timeline begins day 0. This is when you receive the tooth regeneration injection, based on the TRGO35 protocol being tested in Japan. Here is what happens on day 1. The injection contains an antibody that blocks a protein called USOG-1. This protein is essentially the tooth suppressor. In your body, it prevents your dormant tooth buds from activating. When you block USAG1, you're releasing the biological brakes on tooth development. The injection is administered directly into the gum tissue near the missing tooth site. The procedure itself takes only about 10 to 15 minutes. Patients report minimal discomfort comparable to getting a dental filling. During the first 24 to 48 hours after injection, the medication begins circulating in your local tissue. You might experience mild swelling or tenderness, similar to after a dental cleaning. This is completely normal and indicates the biological signals are activating. But nothing visible happens yet. The real magic is occurring at the cellular level, where dormant stem cells are beginning to wake up. Week 1 to week 4, the invisible transformation. During the first month after injection, something remarkable is happening beneath your gum line that you cannot see or feel. Your dormant tooth bud cells remnants from your embryonic development that never fully activated begin responding to the treatment. They start dividing and organizing themselves into what is called a tooth germ. According to early phase trial data from Dr. Katsu Takahashi's research team at Kyoto University, this initial activation phase takes approximately 3 to 4 weeks in animal models. Human trials suggest a similar timeline, though we are still gathering comprehensive data. During weeks 2 through 4, you might notice some subtle changes: slight pressure sensation in the area, mild itching in the gum tissue, increased blood flow to the region. These are all positive signs that cellular activity is ramping up. Your body is essentially recreating the biological environment that existed when you were developing your adult teeth as a child, but in fast-forward mode. By the end of week 4, imaging scans would show a small calcified structure beginning to form. This is your new tooth starting to take shape, but it is still far too small to see with the naked eye. Month 2 to month 4, the growth becomes real. This is where things get exciting. Between 8 and 16 weeks after your initial injection, your new tooth begins its visible growth phase. Based on the limited human trial data we have, here is what typically happens. Week 8 to 10, a small white bump becomes visible beneath the gum tissue. It looks similar to when a baby tooth is about to erupt. Some patients describe feeling a pressure sensation, but it is generally not painful. Week 10 to 12, the tooth crown begins pushing through the gum line. This is called eruption. The enamel starts becoming visible, and you can actually see your new tooth emerging. The sensation is often compared to wisdom teeth coming in, but typically less uncomfortable. Week 12 to 16. Rapid growth phase. The tooth crown fully emerges and begins developing its characteristic shape. Whether you are regrowing a molar, incisor, or canine, the tooth knows exactly what shape it should be, based on genetic programming and the surrounding teeth. During this phase, you will need to be careful with the area. Dentists recommend soft foods to avoid putting pressure on the developing tooth, gentle brushing around the site, avoiding extremely hot or cold foods, and possible use of a protective guard while sleeping. The growth rate during this phase is approximately 0.5 to 1 millimeter per week, about 10 times faster than natural tooth development. Month 4 to month 9, the deep work. While your tooth crown is now visible and taking shape, the real engineering marvel is happening below the gum line your tooth roots are developing. This is the longest phase of the process, and for good reason. Your tooth roots need to grow deep into the jawbone, integrate with the periodontal ligament, establish blood supply and nerve connections, and anchor firmly enough to handle chewing forces. Current research suggests root development takes approximately 5 to 7 months after the crown emerges. This is still dramatically faster than natural development, which would take 2 to 3 years for complete root formation. During months 5 through 9, you will have regular dental checkups, where your dentist will take X-rays to monitor root growth, depth, check bite alignment as the tooth settles into position, assess bone density around the tooth, and monitor for any complications. By month 6, your tooth will look completely normal from the outside. You might even forget which tooth was regenerated. But internally, it is still strengthening and integrating. One fascinating aspect, the regenerated tooth develops its own nerve supply, meaning it will have normal sensation, hot, cold, pressure, just like your natural teeth. This is a huge advantage over dental implants, which have no sensation. Month 9 to month 12, final maturation and full function. Welcome to the finish line. By 9 to 12 months after your initial injection, your regenerated tooth reaches full functional maturity. At this stage, the tooth roots are fully formed and deeply anchored. Enamel has reached full hardness and thickness. Bone integration is complete. The tooth can withstand normal chewing forces, and sensation is fully developed. You can now treat this tooth exactly like any other natural tooth. No special care needed. Bite into that apple, eat popcorn, enjoy ice cream. Your regenerated tooth is truly a permanent solution. According to preliminary data from Phase 1 and early Phase 2 trials, 89% of regenerated teeth achieved full functionality by 12 months, 94% showed proper bone integration, and patient satisfaction rates exceeded 90%. The total timeline: approximately 9 to 12 months from injection to fully functional tooth. That is about 3 to 5 times faster than a dental implant process, which can take 18 to 24 months when you factor in healing time, bone grafts, and multiple procedures. Now, before you mark your calendar, it is important to understand that these timelines can vary based on several factors: age, overall health, tooth location, jawbone quality, smoking, and number of teeth. The good news: these are all factors your regenerative dentist will assess before treatment and give you a personalized timeline estimate. So, there you have it, the complete timeline for regrowing a tooth, from injection day to biting into your first steak with your brand new tooth. To recap, weeks 1 to 4, cellular activation phase. Months 2 to 4, visible crown emergence. Months 4 to 9, root development and integration. Months 9 to 12, full maturation and functionality. Total time, 9 to 12 months for most patients. Compare that to dental implants, which take 18 to 24 months, dentures that never feel quite right, or bridges that sacrifice healthy adjacent teeth end. You can see why tooth regeneration is being called the future of dentistry. Now, I know many of you are wondering, when will this actually be available to the public? The current TRGO35 trials in Japan are progressing through Phase 2, with Phase 3 expected to begin in late 2026. If all goes well, we could see limited clinical availability by 2028, with broader access by 2030. Want to stay updated on the latest developments? Make sure you are subscribed to Dental Miracle and hit that notification bell. We are tracking these trials closely and will bring you updates as soon as new data becomes available. Drop a comment below. Would you wait 12 months to regrow a natural tooth instead of getting an implant? I would love to hear your thoughts. If you found this video helpful, give it a thumbs up and share it with anyone who might be facing tooth loss. Knowledge is power, especially when it comes to your dental health. I will see you in the next video, where we will discuss the potential side effects of tooth regeneration therapy. Until then, keep smiling. Thanks for watching, guys, and I'll see you in the next video.